Everyone, if we could take our seats so we could get started, please. Good morning. Hello, everyone. My name is Dr. Debony Hughes, and I am the Director of the Office of Oral Health for the Maryland Department of Health. And welcome to our launch of Pathways to a Bright Futures program. This program is funded by a Health Resource Service Administration grant to address the workforce shortage in Maryland, focusing on the Eastern Shore, Western Maryland, and Baltimore City. Approximately 50% of Baltimore City, 90% of the Eastern Shore, and 75% of Western Maryland have less than 20 dentists per 100,000 residents, far below the national average of 61. This program is a collaborative effort to work with students to foster their interest in the oral health field and to provide support to those who know they want to practice in the profession. And we are thrilled to recognize the students that are here with us today. As much as I'd like to acknowledge everyone individually, I will not, because undoubtedly I would miss someone. So I will broadly express deep gratitude to our amazing advisory committee, our collaborative partners, and the Office of Oral Health team who make this program happen. And would you all, the Office of Oral Health staff, please stand up so we can give you a round of applause. Thank you so much. Lastly, many thanks to the Maryland Dental Action Coalition, the University of Maryland School of Dentistry, the Maryland State Dental Association Foundation, and the Samuel D. Harris National Museum of Dentistry for working with us to make this day happen. Thank you all for your dedication and belief in this important program. Now, let me introduce the person who runs this wonderful museum, where we're all assembled this morning. Professor and Chair of Dental Public Health at the University of Maryland School of Dentistry and Executive Director of the Samuel D. Harris National Museum of Dentistry, Dr. Rich Mansky.
Well, good morning. How are you? What a great day, huh? I'd like to thank Dr. Hughes for ordering such beautiful weather. Couldn't have had a nicer day. I first want to offer greetings and regrets from our Dean Reynolds. This is a very, very busy time of the year, as you can imagine, with budgets. And he did want to send his well wishes and congratulations. What a great day and great opportunity that you're here. The Pathways program is close to our heart. It's something that we work on as well. It's exciting to see actually how this program has come to be, what the goals are, what it's doing, who's part of it. It was interesting to me to see some of our past students, students that have actually over a long period of time successfully graduated from the University of Maryland School of Dentistry, had a fruitful and very long career, and then retired and then come back to help us at one of our off-site facilities. So that was exciting. Thank you, Dr. Horner, for doing that. I thank all of you. It's actually very nice to see lots of friendly faces. I could tell lots of stories as I'm sitting here looking at John Welby back there, and he'd probably share a story of one of our trials and tribulations that are heading out to a National Oral Health Conference. It's an exciting program, and being here at the museum over the last few years, we've really had a chance to make lots of changes. The museum has become a very different kind of place. I've been responsible for the museum now for about 13 years or so. And when I first became responsible for the museum, it really was a place of things, artifacts, trinkets, stuff for people to come and look. But we're at the University of Maryland, Baltimore. This is a education facility, education system. We have a lot of schools on campus. And we thought our mission had to change, that we need to also be an education facility as well. And that became a big part of our goals and objectives. So one of the things we did is we started to focus on reaching out to very young children for a very similar reason. It's, you talk about pathways and the difference between pathways and pipelining. They're similar, but we understood that we had an opportunity to bring young children in, mostly from Baltimore and surrounding communities, and maybe instill in them a little spark, let them know that they could join us one day in our wonderful profession. They could become a dental assistant, a dental hygienist, a dentist. Maybe that by coming to the museum and learning about oral health and learning about what they need to do to maintain their oral health, they could be inspired, so when they're in middle school, maybe later on, when they're studying and wondering, why am I taking this math class? Why am I taking this science class? This isn't fun. Oh yeah, I remember. They told us at the museum that we can join these wonderful professions, and it's not just our profession. I mean, we think pipelining into any of the many professions we have on this campus is a wonderful thing. So we're hoping that, when they're in middle school, high school, they're motivated all the way through to college, and maybe one day they'll even apply and join us as dental professionals. So we took that a little bit further. We decided that it was important to not only do that here, and we thought it was important to do it in Baltimore, where children really needed a helping hand and needed, it would be good to motivate and get people excited about there are opportunities, there are things they can do, and they could have great careers. So we took the message and decided we're going to take this nationally, and we started applying for grants. And as Dr. Hughes knows, applying for grants is arduous at times. But we were very fortunate. We were able to receive a $1.28 million 5-year award from NIH called The Mouthful of History, where we get to take our messaging nationally. And as part of that, actually separately, we developed a new website. And then within that website, we're developing modules that we're going to bring not only to Baltimore and surrounding communities in Maryland, but across the country. And we're going to be bringing that message, and we're going to be reaching children across the country from unrepresentative groups. We want to really motivate children to become our colleagues. As far as the museum goes, one of the things, I hope you get to tour the museum. I would point to you to that cabinet to my left, because that cabinet represents that point in history where our professions diverged, where medicine and dentistry went on its own path, and how appropriate that it's there, because that's Davidge Hall behind it. And that's the wall that is now separating the Museum of Dentistry from Davidge Hall, where a few of the very first dental lectures were provided back in the 1800s. And I think most of us continue on a path of wanting to bring the professions continually back, because we all know that you can't have good overall health without oral health. So that's our first thing that I would point to. If you get a chance to go up to the second floor, we have a new exhibit that's called Changing Faces, where we get to chronicle how dentistry has changed, since the late 1800s, early 1900s, how it's changed from a profession where it was pretty much as male, white dominated, to a profession that is much, much more inclusive. More women, more minorities, and we're doing such a better job of that. And we're chronicling that. There's more work to be done, but I think dentistry's done a great job and should be proud of it. And that's up on the second floor. We have many other additional exhibits as well that I would hope you get a chance to see. please consider the museum to be a partner. We're excited that we're getting to work with MDAC more now, and Mary has been so kind to be willing to help us, and we hope to continue that relationship. And it's funny, when I was reading through the bios of everybody involved, I couldn't help Civil War fan and golfer. So we have lots to talk about. And I'm happy to talk about almost anything. So if you ever catch me and you want to talk about baseball, football, Civil War history, I'll be happy to do it. But we're thrilled to have you here today, and I'm going to wrap it up and say thank you. Thank you for having us, and thank you for being here. And I'm going to turn it over to our next speaker, to Dr. Hughes.
Thank you, Dr. Mansky. And I hope you all do take some time after the program to tour the museum, because it is so interesting. And you'll learn some things, because every time I come, I do learn more. So let me introduce our keynote speaker, Dr. Nilesh Kalyanaraman. How did I do? Pretty good? Okay. He serves as the Deputy Secretary of Public Health Services at the Maryland Department of Health. He is a leader in improving health outcomes by developing innovative collaborations across healthcare, public health, and communities throughout Maryland. Prior to coming to MDH, he served as the health officer in Anne Arundel County and led the county through its COVID response, the establishment of a gun violence intervention team, and the development of community-led health outreach to advance health equity. For over a decade, he has held leadership positions at federally qualified health centers, including Health Care for the Homeless in Baltimore and Unity Care in Washington, D.C. Please welcome Dr. K.
Good morning, everyone. It's good to see all of you here. Deputy was asking me if I've ever been here before. My dad's a dentist. He is 80 years old and still practicing, by the way. I don't think he'll ever stop. But when I moved to Baltimore, maybe about 12, 13 years ago, saw this on the map, and it was one of the first things we brought him to. And my kids were very annoyed that he was stopping at every single exhibit along the way. It took a long time to get through, but he enjoyed it. I did too, but I don't think at the same level that he did, which is why it's always nice to be back here in this museum. It is a true treasure, and much more importantly, to celebrate this event today. I'd like to first just thank all of our many partners who've made this special event possible. First and foremost, our Pathways to Bright Futures Advisory Committee, whose support has been exceptional from the program's inception. And I'd like to ask the members of the committee to please stand. Don't be shy, come on. Thank you. I'd also like to thank the University of Maryland School of Dentistry, especially Dean Reynolds, Dr. Fleming, Dr. Mansky, and the National Museum of Dentistry staff for your gracious welcome and commitments to the Pathways to Bright Futures. And I also want to thank a hearty thanks to the Maryland Dental Action Coalition. I had the privilege of serving on the board for a short time, and Mary knows that. The Maryland State Dental Association, the Maryland State Dental Association Foundation, for their support, especially in facilitating today's scholarship awards. So when I think about our vision for health equity in Maryland, I see everyone in our state having a fair and just opportunity to be as healthy as possible. It's going to take hard work of people like yourselves, people who understand the importance of oral health, to ensure that health equity includes healthy mouths, teeth, and gums for all Marylanders. And unfortunately, that's not the case today, right? Today, cavities in children and adults and gum disease, especially in adults, are among the most prevalent chronic diseases in the United States. The main reason oral disease is so prevalent is that far too many Marylanders experience barriers to preventive and essential dental care. And these barriers exist for several reasons that we're all aware of, right? Too many people can't afford to go to the dentist. Many don't have dental insurance, and as you know, dental care can be expensive. Additionally, only 1/4 of all practicing dentists in Maryland accept Medicaid. Finding the money to prioritize dental care, particularly preventive care, is hard if you're struggling to make rent or put food on the table. Children living in low-income families are twice as likely to have untreated cavities. There are other barriers to care, like lack of childcare, the inability to take time off from work, or even the lack of transportation to get to an appointment. And then there's the reason that brings us all here today, which is the significant dental workforce shortage in Maryland. This shortage creates an uneven distribution of dental professionals across the state, which leads to decreased access to dental care, especially in already underserved communities. We're seeing that a majority of Maryland dentists practice in more populated and higher income areas, creating significant gaps in access to dental care across other regions of the state. Marylanders in marginalized and rural communities feel the impact of this uneven distribution of dental resources the most. With fewer or even no dentists, and Dr. Hughes highlighted some of those statistics, people are unable to access the care that they need. And so in response to this, and with the help of a grant from HRSA, the Maryland Department of Health's Office of Oral Health has created Pathways to Bright Futures, a program that over time will help to address the dental workforce shortage and create oral health equity in Maryland. Pathways to Bright Futures is a dental education to career pipeline that educates students about the dental workforce shortage, and the program encourages students who live in those dental health professional shortage areas to pursue careers in the dental professions and to work in those shortage areas. And it does this by connecting young people with opportunities to learn about dental careers, to learn with dental professionals, to shadow in dental settings, through scholarship awards, and through participation in events like today's event. Pathways to Bright Futures also works with dental students to encourage them to see the value of practicing in dental shortage areas. The first seminar on this topic for dental students was held at the University of Maryland School of Dentistry last month. Pathways to Bright Futures' goal is to build a diverse and dynamic dental workforce to advance oral health equity by increasing the number of dental professionals practicing in Maryland's dental shortage areas. Achieving this goal won't be easy, and it's not going to happen overnight. But as I said at the beginning, a vision for oral health equity is about the future. And that begins with the caliber of students we are honoring today. You are the diverse and dynamic dental workforce that we need to end the workforce shortage and ensure that everyone in Maryland has a fair and just opportunity to be as healthy as possible. And so congratulations to our honorees. I look forward to the work you'll do to help realize health equity in every community in Maryland, and for one day to you to be the leaders up here, taking us to the next generation. Thank you.
Thank you so much. I hope you all are inspired by those words, because I certainly was. So next, I'd like to introduce Dr. George Shepley. He's been a general dentist in Baltimore, Maryland since 1978. While steadily maintaining his dental practice in Baltimore, he built an illustrious national career. Dr. Shepley is the immediate past president of the American Dental Association, the world's oldest and largest national dental association. Dr. Shepley also served as president of the Maryland State Dental Association, Baltimore City Dental Society, and the Maryland Academy of General Dentistry. Among other recognitions, Dr. Shepley has achieved fellowship and mastership with the Academy of General Dentistry, American College of Dentists, the International College of Dentists, and the Pierre Fauchard Academy. He has also participated in Maryland Missions of Mercy and has been an active participant in the Donated Dental Service Program since 1990. Please help me welcome Dr. Shepley.
Thank you, and good morning to everybody. I'm very excited to be here. I think I was asked because of my position as past president of the ADA. I completed that term in October of last year, and this is the first time I've been up in front of an audience since then. And it's a very timely thing because Friday I'm going to be in that building right next door, historic Davidge Hall, to talk to the Baltimore Alumni Association for their Harry F.W. Dressel Memorial Lecture. So this is a good tune-up for me to get up in front of people and talk, and it's good for me to rekindle my passion for this profession. I love this profession, and I love what I'm hearing about today. I was on the board at ADA for 4 years and president-elect president 2 more years. In those 6 years, I went through COVID. It was an amazing time. I have had the opportunity, I grew up in West Virginia, in the Eastern Panhandle, in the country, you know, rural roads, kids lived in buses and tents, didn't have indoor plumbing. I ended up having my career in Baltimore and been through a lot of health crises, the HIV/AIDS crisis, the COVID crisis, and I've had amazing experiences in organized dentistry. And being in dentistry has given me a life that I could never have imagined as a small boy back in West Virginia. It gave me a life I probably don't deserve. I mean, it's been an amazing life to travel all over the country, even the world, and get to see things. So I have a lot of passion for this. And I love this program because the last 2 years, as I traveled all around this country talking to dentists, 2 issues kept them up at night. One was the declining reimbursements in dental benefits. It's a huge problem, and kudos to what we've done here in Maryland for the Medicaid to try to increase that and get benefits for adults. That's fabulous. But the reimbursements are still low, and what dentists are seeing is that's a huge issue for them because overhead is going up, but the other big issue for them is workforce shortages. There has never been a time in dentistry when there's more opportunity for employment in dentistry. They're dying for dentistry right now. 40% of the dentists are looking for assistants and hygienists, and 90% of those looking explain they're having great difficulty in finding people. So those, I see the dentists who are practicing shaking their heads. They know what I'm talking about. There are so many opportunities in clinical dentistry right now across the board for assistants, hygienists, and even dentists at this point. So I think this is a very opportune time, and I can only tell you that a career in dentistry, it gives you an unbelievable impact on what you can do on people's lives. I mean, you have the ability to really, in dentistry, to transform lives. The things I used to love in dentistry the most is, you know, you'd have somebody come in with a broken down mouth and they were scared and they didn't know what to do. And, you know, part of what's the calling for dentistry is to comfort people, to take care of them and make people healthy. It would be such a great feeling to see someone goes from unhealth and to go to really having health and taking responsibility for their health. When they haven't been able to smile for years and they pick that mirror up and they look at that mirror and smile and their personality changes from there going forward. There's no moment like that that I can really tell you about. It's an extraordinary thing. So you have an ability to make an impact, not just on people's smiles and their oral health, but we know oral health is essential. You can't have good health overall if you don't have oral health. They're connected totally, and especially with things like diabetes and cardiac disease. And in the world of dentistry, you'll find you'll get insight into well-being overall. You'll help diagnose other conditions and empower people to really take responsibility for their lives. And it's the people that make dentistry the best. I'm a little sad because the other exciting thing about dentistry is what you get to do today. In this digital world, you have a little wand where, I don't know if you all have experienced, where you can scan teeth and you get these 3D models of teeth on a screen and you can play with them and do things and manipulate them and do imagery. You can do intraoral cameras and show people the inside of their mouths. You can play with lasers. You can do CAD/CAM milling of restorations and 3D printing today. The technology is extraordinary right now. So it's really a lot of fun, and I think I kind of miss not being able to participate in all these new advances in dentistry. But one thing I will say, for as fun as it is in dentistry today, and as exciting as it is, and all these new opportunities, some things don't change. It's really about the people. And I'll tell you, having people in your life, I was up here in the rotunda between Roland Park and Hamden for 40 years, and having 3 and more generations of patients. You have people come into your life that you know them. They trust you. it's pretty shocking some of the things people tell you about their lives. I mean, you're kind of like a little counselor, a therapist on the side in dentistry. And that's one of the best parts about dentistry. They trust you. We're a very respected profession. The opportunities in dentistry are huge. You know, if you don't like kids, you can work where you don't see kids. If you like surgery, you can work in surgery. If you love kids, you can work with kids. You have a lot of different opportunities to do what you want to do. So I think that's another great aspect of dentistry. You have pretty good work-life balance in dentistry. You know, people don't die typically. You don't have to go home and worry about those type of things. And it's financially rewarding. I mean, I shouldn't talk about money, but I hear hygienists coming out of schools here in Maryland are getting $55 an hour, which, you know, that's just starting out. Really don't even know what you're hardly doing yet. I mean, they are well trained, but it's, you know, it's just amazing to me. I'll share with you, I had a dental assistant for 33 years, an amazing woman. Loved dentistry, loved coming to work. We had so much fun as a family in our practice, and she's moved on from being a dental assistant to running a dental office and doing private consulting. She just called, I talked to her the other day because I've been traveling a lot lately, and she told me last year she made over $200,000 in dentistry with a high school education from being an assistant. So I'm telling you, there's financial opportunities and things you can do in the rest of your life. So it's a great career path. So follow it. You're going to love what you get to do with patients and in dentistry, and to me, it's the best profession in the world. So I want to thank you all for this program, all these people that have actually taken the time to put this together. It's exactly what we need. I know Bernie Sanders gave me a call when I was president, and he asked me, what's the biggest problem in dentistry? I thought he was going to beat me up about dental therapists and Medicare for all, but I told him about workforce. He said, I'm on it, we're going to do something. And I know there's just been a bill that he's promoting about trying to increase opportunities for workforce. So there'll be a lot of resources, a lot of great things. Thank you all. Have a great career in dentistry.
Thank you so much, Dr. Shepley. So you all have heard there are so many wonderful opportunities in the profession. And that's why we're so excited to be able to work with students and dental students in these HIPSA areas to get them interested and involved in applying to the profession. So now is the really exciting part where we get to recognize our students. First, we have Mrs. Mary Backley with the Maryland Dental Action Coalition, and then to follow her is Dr. Thomas Beckett from the Maryland State Dental Association Foundation, who will also present awards.
Thank you, and good morning, everyone. It's nice to see everyone. Many friends, many colleagues, many partners, former board members. Very good to see you. It's really quite an honor to be here today. And the Pathways to Bright Future Academic Award is an award of $2,000 presented to a student who wants to work in a Maryland dental health professional shortage area and has applied to an academic program to advance their dental career. The Maryland Dental Action Coalition is honored to be a part of this unique program and lead a subcommittee of professionals charged with the development of academic award criteria, eligibility, application, and selection of academic award recipients. I am very grateful to the following subcommittee members for their valuable expertise and participation in the process. Brianne Datry, Coordinator of Apprenticeship and Workforce Development, Allegheny County Public Schools. Dr. Sandra Garbly-Kirkovich, Vice President and Dental Director, Choptank Community Health Systems. Diane Palmer, Executive Director, Maryland Foundation of Dentistry. And Dr. Catherine Pollack, a pediatric dentist and founder of a 501c3 organization called Planet Smiles, a pediatric dental nonprofit that works to educate children about the importance of oral health. Student response to this opportunity was very positive, and all subcommittee members were inspired by the students' commitment and dedication to the field and giving back to the community. MDAC looks forward to this special recognition becoming an annual event, an opportunity to support student learning an expansion of the state's dental workforce in health professional shortage areas. So, now it's time to announce the winners. MDAC is very pleased to announce the recipients of the inaugural Pathways to Bright Futures Academic Award. I will announce each recipient alphabetically and present each with a certificate of award representing this wonderful achievement. And in doing so, I will announce their field of professional career focus, as well as their academic institution and their health professional shortage area that they are aspiring to work in. And I also want to include a paragraph or an excerpt from their application or their letter of reference to really let everyone know the extraordinary dedication and of each and every one of them and their incredible commitment to the field and learning. So let's start with our first recipient, Cheyenne Kennedy. Cheyenne is practicing to be a dentist at the University of Maryland School of Dentistry, and she is planning to work in Baltimore City. And I am very pleased to read an excerpt from her letter of reference provided by Dr. Amber Royal, owner of Smile Street Dental. Cheyenne's ambitious and driven nature extends far beyond her workplace duties and fulfillment. She has created a nonprofit organization, You Are Not Alone, that focuses on providing hygienic essentials to populations in need. She has also volunteered her time for the past 3 years, attending dental mission trips with Global Dental Brigades in Honduras. Ms. Kennedy has maintained her commitment to making a difference and serving those in need by continuing her volunteer efforts despite the uncertainty associated with the global pandemic. Very consistently, she demonstrates an unyielding passion for the field of dentistry. Ladies and gentlemen, it's really my pleasure to introduce and acknowledge and recognize Cheyenne Kennedy. Would you like to say something? Please.
Good morning, everybody. My name is Cheyenne. I just want to say thank you for choosing me as a recipient of this Pathways to Bright Futures Award. I really appreciate it, and it's definitely going to help me with my goals to further my nonprofit and make mobile hygiene clinics around Baltimore City and to be a dentist and help others. That's all. Thank you.
Thank you, Cheyenne. Our next recipient, Yehuda Diamond, is studying to be a dentist at the University of Maryland School of Dentistry, and he hopes to practice here in Baltimore City. I met Yehuda a few minutes before this ceremony, and he told me that his brother is already practicing here. So we are so delighted, Yehuda, that you will be practicing here. I am going to read an excerpt from a reference for Yehuda's application that was provided by Dr. Neil Miller, who's a professor at Stevenson University. What truly sets Yehuda apart, however, is his unwavering commitment to helping others. Despite the demands of his rigorous academic schedule, Yehuda always makes time to assist his classmates, approaching each interaction with humility and genuine kindness. His willingness to share his knowledge, coupled with his emphatic nature, created a supportive learning environment that benefited everyone. Yehuda possesses a strong sense of responsibility and a deep understanding of the importance of community service. His involvement in various volunteer activities, both within and outside of the school, reflects his commitment to making a positive impact on the lives of others. Please join me in congratulating Yehuda Diamond.
Hello. Just wanted to say life is super busy. and in life, sometimes you could lose track. We're standing here, and our goal is, our recipients at least, and many of the people standing here, is that we're helping underserved communities. but sometimes life can sometimes get too busy, and we forget that and lose track. But programs like this and all the people involved are the people who will remind us about this and push us to do more and more and more. And I'd like to thank this program and Mary for really answering all my questions, and I really appreciate everything that this company does.
Thank you. Our next recipient is Haley McNinch, who is studying to be a dentist and attending the University of Maryland School of Dentistry. And Haley hopes to be able to practice in Caroline and Queens Anne's County. I am delighted to read an excerpt from a reference that was provided by Dr. Jean Carlson, who is the instructor at Chesapeake College. Haley aspires to be a practicing dentist on the Eastern Shore of Maryland, which has been her lifelong home. She is from Denton in Caroline County, having attended local schools and participated in extramural activities in the area. Since meeting Haley, I have been impressed not only by her intelligence and ambition, but by her kind and gentle nature and sincere desire to help those around her. She has told me on several occasions that her dream is to return to the Eastern Shore following her matriculation in dental school, so that she may be of service to those most in need in that area. She will be a model of the kind of caring professional that our population so desperately needs. Ladies and gentlemen, Haley McNinch.
Just wanted to say thank you to this organization and everyone who supported me. I really, really appreciate it, and it's such an honor receiving this. And I'm just really excited to see the positive change in increasing accessibility that this organization and this program and this award will do. And I really hope to be a part of that change on the Eastern Shore and in all of Maryland in my career and throughout school. So thank you again.
Thank you. Our next recipient, Hernajan Tundag, is studying to be a dental hygienist at Hagerstown Community College and hopes to be able to work or will work in Frederick, Washington, or Carroll counties. For Hernajan, I am going to read her response to a question on her application. What attracted you to a career as a dental hygienist? I am deeply drawn to the profound impact that a beautiful smile can have on one's confidence, self-esteem, and overall well-being. As a future dental hygienist, I am impassioned by the prospect of not only restoring and preserving oral health, but also educating patients on the important dynamic nature of the profession, where each day brings new challenges and opportunities for growth, excites me. Ultimately, the prospect of making a tangible difference in the lives of others through compassionate care, education, and advocacy for oral health is what fuels my passion for pursuing a career as a dental hygienist. Ladies and gentlemen, Hernajan Tundag.
Hello, everyone. I just wanted to say that I am truly honored to receive this award. This recognition means a lot to me, and I want to extend a special thank you to the Maryland Dental Action Coalition and the Pathways to Bright Futures Advisory Committee. Your support and belief in me has been instrumental in my journey, and I can't wait to make meaningful differences and contributions to our field. Thank you all so much.
Our next recipient is Jade Wetherington, who is studying to be a dentist, attending the University of Maryland School of Dentistry, and Jade aspires and will be working in Baltimore City. I am also going to read Jade's response to the question, what attracted you to a career as a dentist? At the core of my passion is a dedicated commitment to making a compassionate impact on the oral health of minority populations. Recognizing disparities in dental care within these communities propels my desire to be a devoted professional addressing this pressing need. I am driven by a heartfelt